Pregnancy and childbirth are challenging, even under the best circumstances, but in survival situations, they can become life-threatening without proper preparation. With my background as a family nurse practitioner, former 160th SOAR flight medic, and alternative medicine fellow, my presentation will provide essential guidance on preparing for pregnancy, managing childbirth, and navigating postpartum recovery and survival scenarios. It combines both primary and alternative care approaches to ensure comprehensive support. First trimester preparations. Key focus: early nutrition and managing symptoms. Prenatal vitamins. Stockpile high-quality vitamins containing folic acid, iron, and calcium to support early development. Morning sickness relief. Keep ginger or peppermint tea on hand to ease nausea. Hydration. Always prioritize clean water and electrolyte solutions. Foods to prioritize include folate-rich foods like spinach, fortified grains, and lentils to support neural tube development. Second trimester preparations. Key focus: growth tracking and mid-pregnancy planning. Tracking development. Use a calendar or pregnancy journal to monitor milestones and symptoms. Birth plan. Start preparing a detailed birth plan, including whether you'll give birth at home or elsewhere. Supplies. Begin assembling your birthing kit and medical supplies. Third trimester. Preparations. Key focus: labor readiness and emergency protocols. Finalizing supplies. Double check your birthing kit to ensure all necessary items are sterilized and ready to go. Uterine prep. Drink 1 to 2 cups of red raspberry leaf tea daily to tone your uterus for labor. Positioning practice. Practice squatting or kneeling positions to prepare for labor. Avoid lying flat on your back. Emergency decision flowcharts. The following flowcharts can guide decision-making during critical childbirth situations. 1. Breech birth. Is the baby feet or buttocks first? Yes. Immediately shift the mother into the knee-chest position to encourage the baby to turn. If unsuccessful, proceed with a cautious manual delivery while maintaining communication with the mother. No. Continue monitoring labor progression. 2. Hemorrhaging. Is there heavy bleeding post-delivery? Yes. Administer shepherd's purse tea. 1 TSP dried herb steeped in boiling water, 1 cup as needed. Apply firm pressure to the uterus to help it contract. Seek medical attention if bleeding does not stop promptly. No. Monitor mother and baby for signs of other complications. 3. Signs of infection. Is the mother's temperature over 100.4 degrees or does the incision perineal area show redness, swelling? Yes. Cleanse the area with warm water and mild soap. Use calendula or witch hazel in a sitz bath for symptom relief. Seek antibiotics or medical attention if symptoms worsen. No. Proceed with standard postpartum care. Step-by-step emergency protocols. 1. Hemorrhaging. Apply direct pressure to the uterus using both hands. Administer shepherd's purse tea for herbal assistance. Encourage the mother to stay calm and hydrated. 2. Breech birth. Place the mother in a knee-chest position with hips elevated. If delivery is imminent, guide the baby's body gently to avoid complications. Continuously monitor the mother's vital signs. 3. Preterm labor. Ensure hydration with clean water or electrolyte solutions. Minimize physical activity and have the mother lie on her side. If contractions persist, use warm compresses on the lower back for pain relief. Equipment recommendations. Building a survival birthing kit is critical. Include the following supplies: umbilical cord, clamps, Kendall Monoject cord clamps, sterile gloves, Medline, sterile nitrile, exam gloves, suction bulbs, Medline, newborn nasal bulb, syringe, sterile scissors or scalpel, Miltex, Spencer, stitch, scissors, antiseptic wipes, Dynarex, BZK, antiseptic towelettes. Alternative remedies and dosing instructions. Red raspberry leaf tea. Drink 1 to 2 cups daily, starting in the second trimester, to tone the uterus. Fenugreek, lactation. Take 2-3 capsules, 500 mg each, daily, or brew as tea. Shepherd's purse. Tea. Steep 1 TSP of dried herb in 1 cup of boiling water to aid with postpartum bleeding. Chamomile for relaxation. Brew 1-2 cups daily to reduce stress and support sleep. Warnings and disclaimers. Blue cohosh. This herb is potent and may induce labor. It can be dangerous without proper guidance. Consult a trained professional before use. Emergency situations. Always prioritize professional care or seek immediate medical attention for complications like severe bleeding, fever, or infection. Limits of remedies. Herbal remedies are supportive but should not replace antibiotics for infections or other professional treatments. Postpartum recovery and survival scenarios. Physical recovery. Wound care. Clean the perineal area with antiseptic wipes or warm water with mild soap. Use calendula or witch hazel sitz baths to reduce swelling. Pain relief. Over-the-counter ibuprofen can reduce discomfort from cramping and tearing. Breastfeeding support. Hydration and nutrition. Drink plenty of water and focus on iron-rich foods like beans and leafy greens. Milk supply aids. Incorporate oatmeal and fenugreek into your diet. Mental health. Relaxation. Drink chamomile or lavender tea to ease stress. Adaptogens. Consider ashwagandha for emotional support and postpartum depression symptoms. Practical tips for baby care and survival scenarios. Hygiene. Use clean water and mild soap to gently clean the baby. Keep the umbilical cord stump dry and cover it with a sterile gauze. Warmth. Layer clothing to keep the baby warm, especially in colder climates. Utilize skin-to-skin contact to naturally regulate the baby's temperature. Feeding. Breastfeeding is ideal, but if unavailable, prepare emergency formula using powdered milk and sterilized water. Final thoughts. Pregnancy, childbirth, and postpartum recovery and survival scenarios demand preparation and adaptability. By focusing on proper equipment, emergency protocols, and natural remedies, you can ensure a safer experience for both mother and baby. What's in your survival birthing kit? Share your tips, ask questions, or tell us how you're preparing for pregnancy and childbirth in a survival setting in the comments below.